November is Lung Cancer Awareness Month, so this morning we are taking some time to focus on the health of what keeps us breathing. Joining me now from Virginia Mason Franciscan Health are two cardiothoracic surgeons, Dr. Daniel Cuadrado and Dr. TJ Templin. Thank you both for being here.
Thank you.
I have so many questions to ask, but just really quickly, I don't think people really understand how important the function of the lung is. I mean, it's truly what is cleaning our blood and doing all these things, right?
Yeah.
So let's talk about screenings. Why is it so important for us to have lung cancer screenings?
Talk about the demographics.
Yeah, so lung cancer is the #1 cancer killer in the world of both men and women.
Oh, wow.
So it's so vitally important that we get a handle on it around the world. Really, the main cause of lung cancer is smoking traditionally. There's been some new cancers that we're finding in non-smokers, but so important to get the people who have been smokers their whole lives screened. And so if we think about it in the state of Washington, about 50 out of 100,000 people will be diagnosed with lung cancer in the state of Washington alone, and about 30 out of 100,000 will die from lung cancer in the state of Washington.
Oh my gosh.
So vitally important.
Those are serious numbers.
Yeah,
and I'm glad you brought the
huge.
numbers this morning. So, okay, what do people need to know about what types of screenings are available? I mean, what do you ask for?
Yeah, so really it starts with your primary care doctor.
Okay.
So anyone who smoked more than a pack a day for 20 years,
Okay.
between the age of 50 and 80, is eligible for lung cancer screening. And lung cancer screening is as simple as a CT scan. So you lay down on the table, you get a 10-minute CT scan, and those results are read and referred to your primary care doctor. Anyone with a nodule that's found will then come into the lung cancer nodule pathway where we can get a diagnosis and potentially get them treated even at the same time.
I know you talked about smoking, because we know that. What other lifestyle factors impact lung cancer risk?
There's a lot of things that are being looked at, environmental factors. One of the new ones that's really getting a lot of press right now is marijuana smoking. So prevalent in a lot of our states now, especially here in Washington. There's some new studies that came out. The combination of smoking, both cigarettes and marijuana, increases lung disease significantly in people.
Yeah.
So we're worried about that. It's going to really increase the lung cancer numbers. There's also some genetic factors that we're finding. So certain demographics are at an increased risk of lung cancer that are non-smokers, unfortunately.
Interesting. This is really fascinating stuff, and I'm glad the research is continuing. How is treatment advancing in the diagnosis of lung cancer?
Yeah, so nowadays we have very powerful and advanced robotic techniques that we can diagnose it. So we have the ability with a bronchoscopy to go down and sample the nodule itself and determine whether it's cancer. And oftentimes in the same setting, we can do a surgery then to remove the cancer if it's an early stage.
Wow.
For cancers that are more than an early stage cancer, we have ways to look at the tumor itself at the genetic level so that we can tailor therapy to patients based on the biology of their tumor with some of the newer medications that are out there.
This is incredible stuff. This is giving hope. I mean, everyone needs to do their part, stop smoking, try to live as healthy as you can, but when it becomes inevitable, this is incredible. What would happen? Let's say, we're starting to hear more and more about the prevalence of younger people getting lung cancer. Some smokers, some not, and it's sad, it's tragic. What are some signs and symptoms people should look for?
That's the difficulty with lung cancer, is there really aren't any signs and symptoms until it's too late.
Wow.
So by the time that they know about it, you're coughing up blood, you're having difficulty breathing, or you just feel like you're winded all the time or can't do the things you normally did, it's already too advanced. So that's why screening is so important for patients that meet the criteria that Dr. Cuadrado talked about. We have to get those patients in. For every patient that we find an early stage lung cancer on and we can surgically remove that, we have now increased their survival up to 80 to 90% for 20 years.
Yeah.
We used to look at cancer survival as within these 5-year increments. So overall lung cancer survival across the world, really, and mainly U.S. statistics say 25% of people will be alive at 5 years after their diagnosis of lung cancer.
That's incredible.
So 1 in 4 people will be alive. So that if you take 3 out of those people will be dead from lung cancer. We can get that up to 80% survival, maybe 90% survival at 20 years if we find it early and we can take it out.
That's amazing. I know that a lot of people have asked, okay, let's say I don't meet the criteria, should I still ask my doctor for a screening? But there is kind of concern in getting too many CT scans, right?
There are, and it's not just the radiation. Whenever we do a CT scan, we will see other things. So when we look at the populations that we do lung cancer screening in, that's the population, those higher risk patients are the ones really with the most benefit. There are oftentimes that you'll find nodules in people that have never smoked, and it's not the presence of a nodule, it's a nodule in someone who's high risk that changes over time, that grows over time.
Got it.
So getting too many tests, again, you may find unnecessary nodules that may lead to unnecessary anxiety and maybe even procedures.
That's true. Okay. Thank you both so much. I feel like I've gotten such a great education on this today. And what would you each like to leave our viewers with? Any takeaways that you'd like to give them?
Yeah, I think that number one, if you're smoking, quit smoking. But if you or any of your family members meet those lung cancer screening criteria, it's as simple as a discussion with your primary care doctor to get the process started.
Yeah.
Yeah, and it's not a scary process anymore. Everybody is so concerned, oh, what are they going to find? What are they going to find?
Yeah.
You know, are they going to find a nodule, or what are we going to do about it? All these things. We've got such minimally invasive techniques to help diagnose these things, find these things, and treat these things. Just come see us, talk to us. You know, we'll get you through it.
Well, just sitting here with you both has given me so much more insight on what is happening in this medical field, and I hope that everyone else out there, if they had concerns, don't have them anymore. Go see these guys right now, all right?
All right.
Thank you so much. I really appreciate your time today.
Yeah.
Thank
you for having us.
Absolutely. All right, to learn more about lung health and what we discussed today, just visit the website on your screen, vmfh.org/lung screening.
This portion of New Day Northwest is sponsored by Virginia Mason Franciscan Health.